My name is Erin Espinoza, and I'm a hematologist at the TriHealth Cancer and Blood Institute. A hematologist is a person who specializes in blood disorders, and these can be cancerous blood disorders or non-cancerous blood disorders. My specialty specifically is under the non-cancerous blood disorders. So these range between patients who are more prone to bleeding and bruising versus those who could be more prone to forming blood clots. I also see patients who have a wide range of other disorders related to their blood work, whether it's the white blood cells, red blood cells, or platelets. And I also see a large portion of our sickle cell population, which is within the Cincinnati area. One of the things I enjoy about being a hematologist is it's kind of like figuring out a puzzle or a problem and ensuring that patients are getting the correct diagnosis while also getting the best treatment for any potential complications that could arise in the future. With our obstetrician group, and especially our high-risk obstetrician and gynecology group, we, with hematology, have formed what we call the Center for Hematologic Issues in Pregnancy, or CHIP. This is a multidisciplinary team with the two specialties, OB and hematology, that discusses complex patient cases, whether they're related to the current pregnancy or even a potential future pregnancy. Again, we're focusing on the non-cancerous blood disorders, and these are typically young women who are more prone to bleeding, and we need to be prepared for what to expect at the time of delivery when bleeding is very high risk, or they're more prone to blood clots, and pregnancy is another time that is high risk for forming blood clots. Falling under the patient blood management program is what we call the anemia clinic. And this is a quick referral service from typically our surgeons and obstetricians for patients who have anemia or low hemoglobin red blood cell counts. Typically, these patients are low on iron, which is the cause of the anemia, and our goal is to ensure that they're getting their anemia improved and optimized before surgery and before delivery for pregnancy. The most satisfying part of my job is when I can really give patients that reassurance that we're here for them. And we have a diagnosis, we know what the next step is, and we're gonna help lead them along the way. And I always tell this to my patients, that they can call us with any questions, concerns, even if it's just trying to schedule another specialist appointment. We really are here for them. We're also here for their families. And we wanna make sure that their families that they bring in, or their friends who feel like family that they bring in, are also aware of their disease and can help kind of guide them through the process too.